Assalamu alaikum, Exis. Welcome again to your favorite platform. After Assalamu alaikum and welcome to your Bosom platform Exis. Dear spectators, today we are living in a competitive world, and for that, just being in the bookish knowledge, it's not enough for us. Including the bookish knowledge, we have to cooperate with the world, and that's why we have to know some other knowledge. And with that motto, Exis has arranged a competition, Exis paper presentation competition, which will give us some international presenter. And with this program will be moderated me, Ifra Jahan Raha from Holy Family Red Crescent Medical College, session 2018-19. And today's program will be presented on the topic Periodontal Ligament by the group Explorer. And this group will be explored by three presenters. The presenters are Dr. Mohammad Emon Talukder, intern City Dental College and Hospital, Dr. Nafisa Afroze, intern Dhaka Dental College, Dr. Tahira Binta Mizan, intern Ibrahim Medical College. And this competition will be judged by three upstanding judges, and the judges are Dr. Anirban Chatterjee sir, Ex.Vice Principal, Professor and Head Department of Periodontics and Implantology, the Oxford Dental College Hospital and Research Center, Bangalore, India, President, Indian Society Periodontology, and Dr. Farida Ilius ma'am, Principal, City Dental College, and our Dr. Anupam Podder sir, Associate Professor and Head Department of Periodontology and Oral Pathology, Dhaka Dental College. Before commencing the main program, I would like to request our judges to give us some advice to our presenter and some of their experiment, as they had seen our first episode, which was held 3 days before. So first of all, I would request Dr. Anirban Chatterjee sir to tell us something about the program. Sir.
Thank you for the wonderful introduction. It was a lovely program, whatever we had seen in last program. There is a lot of improvement which has been done in this during this time. Presenters were very well known with the subject, and they already know what next needs to be done. This way we are promoting, and especially thanks to Axis Dental for promoting periodontology in Bangladesh. And with this, I think this type of programs will continue in future, and we can get a better hold of the subject, which is lacking behind in Bangladesh. Thank you.
Thank you so much, sir, for your priceless comments. Now I would like to request our Anupam Podder sir to give us such a statement about the program. Sir, please.
Thank you, Dr. Ifrat Raha, for his nice introduction. I would like to thank the Axis platform for arranging this type of excellent and informative program, and this is encouraging program. And I like to thank our today's judge, Professor Dr. Anirban Chatterjee, Ilius, and me, and also thanks to our three presenters, Mohammad Emon Talukder from City Dental College, Dr. Nafisa Afroze from Dhaka Dental College, and Dr. Tahira Binta Mizan from Ibrahim Memorial Medical College. So I would like to thank all and Group Explorer, and today's topic is very much basic topic. This is periodontal ligament. I wish all do better and wish their success of today's presenter. Thank you.
Thank you so much, sir. Now I would like to request Dr. Farida ma'am to give us give our participants some advice about the program. And ma'am, Can you hear me?
Yes, I can hear you. Assalamu alaikum. Thanks a lot for your deeds. Excellent program. Actually, accidental, they are doing a lot for the knowing or enlightening the subject periodontology throughout the dentistry. It is actually very good, innovative and initiative, and I am thanking you, and I am also welcoming our three speaker, Dr. Emon from City Dental College, Dr. Nafisa, Dhaka Dental College, and Tahira Binta, Mizan from Bardem Dental, Ibrahim Medical College Dental Unit. And actually, topics is very good, and I know they will be covered. They will present it within. They will be available. Thing you are allocating this presentation in the slide form and every point. You are the person who are educating these doctors and also students. Students are having within our program. So thanks a lot again to you, and also Professor Anirban Chatterjee and dear Dr. Anupam. Okay, you continue, please.
Thank you so much, ma'am, for your priceless comments. And before commencing the main competition, I would like to inform our participants about some rules about the competition. Each participants will get 10 minutes for their presentation, and after finishing their 8 minutes, I will give them a reminder, and the rest 2 minutes will be their finishing time to complete their presentation. And after finishing the presentation of 3 of the presenters, there will be a discussion part where the presenters and the judges, there will be a discussion part, and there will be a question answer portion, maybe, inshallah. So I would like to, without delaying more, the program should be started. And first of all, I would like to call Dr. Mohammad Emon Talukder Bhaiya from City Dental College and Hospital to represent his presentation, please. Bhaiya.
Thank you, Ifrajan Raha. Assalamu alaikum, Honorable Judges, Dr. Farida Ilias ma'am, Dr.Anupam Podder sir, and Professor Dr.Anirban Chatterjee sir. And dear moderator and my fellows, Dr. Nafisa Afroze and Dr. Tahira Binta Mizan, and viewers, good evening and welcome to my presentation. First of all, I would like to thank you very much, Ex.Vice Dental School, to organize such a nice knowledge sharing program. Ex.Vice Dental School Paper Presentation Competition 2021. I am very much grateful to Ex.Vice Dental School to give me the opportunity and makes a part of this great platform of the dental education. Hello, I am Dr. Mohammad Emon Talukder from City Dental College and completing my internship from City Dental College. And my session is 2015 and 16. Today, I am going to present an interesting and more basic topics of oral anatomy and periodontology, that is periodontal ligament. Here is my content by which my presentation is made. The content is introduction, definition, synonyms, extent and shape, average width, development of periodontal ligament, and some references. Introduction, we all of knows that the periodontium is the most important structure of a tooth, and the strength of a tooth depends on the condition of the periodontium. And the periodontium has different components such as hard tissue component and soft tissue component. And the most important soft tissue component is periodontal ligament, which is our today's topics. The normal periodontium is a unique and complex dynamic structure, each of its components having distinct functions that are capable of adaptation during the life of the structure. Periodontal ligament is the basic and soft tissue component of periodontium. Periodontal ligament is the soft, richly vascular and cellular connective tissue which surrounds the root of the teeth and joins the root cementum with the socket wall. My next slide is definition. Here is some definition collected from textbook. According to Karanja and Bernard, the periodontal ligament is connective tissue that surrounds the root and connect it to gingiva and communicate with the marrow space through vascular channels in the bone. And according to AR10 kits, it is a soft, specialized connective tissue situated between the cementum covering the root of the tooth and bone forming the socket wall. According to Urbans, the periodontal ligament occupies the periodontal space, which is located between the cementum and the periodontal surface of the alveolar bone and extend coronally to the most typical part of the lamina propria of the gingiva. Continue with the next slide. My next slide contains synonyms of the periodontal ligament. Here is some synonyms. The most commonly used synonyms is periodontal membrane. The other synonyms is desmodon, pericementum, dental periosteum, alveolo-dental ligament, and gomphosis. In this figure, I showed the gomphosis joint from which the synonyms is collected, gomphosis. The extent of periodontal ligaments, it is the coronal direction. In the coronal direction, it is continuous with lamina propria of gingiva and is demarcated by the alveolar crest fiber. At the root apex, it merges with the dental pulp. You can see in the picture the extension of the periodontal ligament, and all of these are vertical extension, and the horizontal extension of periodontal ligament is from cementum of the root to the alveolar bone. Next slide is shape of the periodontal ligament. The shape of the periodontal ligament is thinnest around the middle third of the root with an hourglass appearance. And you can see in the figure how the hourglass appearance is look like. The ligament appearance as a radiolucent area of 0.4 to 1.5 millimeter between the radioopaque lamina dura of the alveolar bone and cementum, according to Urbans. Now I am discussing about the average width of the periodontal ligament. The average width of the periodontal ligament totally depends on the age and the functioning condition of the tooth. Depending on the age, it is reversely proportionate to the average width of the periodontal ligament reversely proportionate with the age. That means increasing the age, decreasing the periodontal width. Here you can see the statistics. Here you can see that increasing the age and decreasing the periodontal width. And according to functional state of tissue, time of eruption, it was 0.1 to 0.5 millimeter. And when at the function, 0.2 to 3.5 millimeter, that means when our tooth are in functional condition, the periodontal ligament get stressed and the average width become wider. And hypofunction, 0.1 to 0.15 millimeter. Here the width is reduced because their periodontal ligament remain in rest position. Now next to the let's move to the next topics, more important topics, development of the periodontal ligament. All the periodontal tissue are derived from dental follicle, which turn originates from dental papilla. Mesenchyme deriving the periodontium may have two different components, alveolar clade and cemental clade. The alveolar clade contains osteoblast and fibroblast, and the cemental cloid contains cementoblast and fibroblast. Here you can see a figure of tooth germ from where the dental follicle, here the below part is dental follicle formed by the ectomesenchyme, and in the upper portion there is enamel organ, and from where below the enamel organ there is here is dental follicle from which the periodontium is developed. The development of the periodontal ligament begins with root formation and prior to the tooth eruption. At the late pale stage, when amelogenesis and
Dr. Emon,
dentinogenesis...
you have completed your 8 minutes. You are requested to complete it within 2 minutes.
When amelogenesis and dentinogenesis are well advanced, the internal and external enamel epithelium at the cervical root of the enamel organs form a double-layered epithelium root sheath which proliferate apically map out of the shape of the future root. After proliferation of the follicular cell, the innermost cells of follicle near forming the root differentiate into the cementoblast, and the outermost cells differentiated into osteoblast. The centrally located cells differentiated into fibroblast, and these fibroblasts produced collagen fibers, and they produce periodontal ligament fiber. And these fiber get embedded in developing cementum and alveolar bone. Here I show a flowchart of periodontal flowchart of development of periodontal ligament. This flowchart after root formation completed, hardening root sheath loses its structural continuity. The remnants of hardening root sheath known as epithelial red cell of Melasses, which remain in the cervical lobe area. Connective tissue cells of dental follicle start migrate to the newly formed root dentin. As the root formation continues, cells in the perifollicular mesenchyme gain to the polarity, cellular volume, and become widely separated. Fibroblasts actively synthesize and deposit collagen fibrils and glycoproteins in developing periodontal ligament. Here you can see a figure where the hardening root sheath cells is situated, and from where the initiation of the development of periodontal ligament is began. The next is type 1 and type 2, type 1 and type 3 collagen is secreted and in assemblage over the alveolar bone and cementum. Here is my reference from where I collect the information. The clinical periodontology written by Karanja and Newman, 10K soil histology, urban soil histology and embryology, dental anatomy and oral histology by Arup Kumar Das. Thank you very much for your attention. Good evening.
Thank you very much, Dr. Emon Talukder for such a nice presentation. Now I would like to call Dr. Nafisa Afroze, Intern Doctor, Dhaka Dental College, Apu. It's your time to represent the presentation.
Dr. Emon Talukder, please cancel your start screening, please. I need to start mine. Emon Talukder, screen to share if you want to go on, please. Assalamu alaikum, my fellow mates, all my respected judges, and Dr. Farida, Ilius Madam, Professor Dr.Anirban Chatterjee Sir, Dr.Anupam Podder Sir, my fellow mates, and all the audiences out there. Assalamu alaikum. Firstly, I would like to thank our honorable judges for sparing out some time from their busy schedules for all of us. And I would also like to thank Ex.Vice Dental School for creating such an amazing platform for all of us so that we can learn and explore more in a befitting manner. Now, without making further any delay, I would like to start my presentation. Firstly, I would like to introduce myself. This is Dr. Nafisa Afroze, currently working as an intern doctor at Dhaka Dental College and Hospital. Today, my topic is structural components of periodontal ligament. The structural components of the periodontal ligament can be divided in two portions, the cellular components and the extracellular components. The cellular components can be divided into five portions, that is synthetic cells, resorptive cells, progenitor cells, epithelial cell rest of molasses, and Refenrences cells. And for extracellular substance, we have fibers and ground substance. Now, if we move to the synthetic cells, the first cells we have is fibroblasts. which is the predominant cells in the periodontal ligament. Now, if we see in the figure, the fibroblast cells usually fusiform in shape with thin and long cytoplasmic extensions. The cells have abundance of cytoplasms with mitochondria, Golgi apparatus, ribosome, and nucleus, which is centrally placed in the cells. Usually, the cells are oriented parallel to the direction of the collagen fibers. Now, if we move to the function of the fibroblast, it has usually 5 types of function. The first one is synthetic function. The synthetic function includes synthesis of collagen fibers, elastin fibers, connective tissue proteins, and extracellular matrix protein. The number 2 is maintaining the width of the periodontal ligament by reforming and remodeling the periodontal ligament fibers. Number 3 is cell differentiation because the cell has the capacity for giving rise to other cell types such as cementoblast or osteoblast. Number 4 is Sharpest fiber formation, which can be done by synthesis of extracellular matrix proteins in which collagen fibers bundle and helps in the formation of Sharpest fiber. Number 5 and the last but not the least, that is rapid collagen degradation, which is done by the fibroblast phagocytosis. The next synthetic cells that we have is osteoblast. As we see in the picture, it is cuboidal in shape, which is uninucleated, and a prominent nucleus that is placed at the basal end of the cells. Usually, this covers the periodontal surface of the alveolar bone. The function of the osteoblasts, usually they are bone-forming cells that lines the tooth socket. The next synthetic cells that we have is cementoblasts, which are often indistinguishable from the periodontal fibers apart from their position adjacent to the cemental surface. Usually, they are also cuboidal in shape with large vesicular nucleus, and the function of the cementoblast is the lining of the surface of the cementum. Next, we are moving to resorptive cells. The first resorptive cells that we have is osteoclast. Now, if we see in the picture, the osteoclasts are usually large and multinucleated, but can be small and uninuclear. While multinuclear osteoclasts are usually formed by the fusion of cells similar to the circulatory monocytes. The plasma membrane, as we see here, the lying adjacent to the bone has some characteristic folds that are known as ruffled border, and these cells usually found in some shallow depression in a bony surface that's known as Hausch's lacuna. The functions of the osteoclasts are they help in usually responsible for the remodeling that allows functional changes in the position of the tooth. The next resorptive cells we have is cementoblast. Usually the cementoblast resemble osteoclast and they are located in depression in cementum resembling Hausch's lacuna. Though the name is cementoblast, but they usually do not resorb cementum. They usually occur in certain pathological conditions such as resorption of deciduous tooth, sometimes in some pathological condition and sometimes in orthodontic therapy. The next cells we have is progenitor cells or undifferentiated mesenchymal cells. If we see in the picture or figure, the dental follicle stem cells, which are differentiated in other cell types, that is cementoblasts, fibroblasts, and osteoblasts. And that is the reason for which dental follicle stem cells are known as progenitor cells, because they have the capacity for division and also replace the differentiated cells. These cells are mostly found in highest concentration in location adjacent to the blood vessels. The next cells are epithelial cell rest of Malassez, which are described by Malassez in 1884. These cells appear as small clusters, which found in periodontal ligament adjacent to the root surface and cementum. The epithelial cell rest of Malassez can persist as network of strands and tubule as found in the diagram. Now, the cells may proliferate to form cysts and tumors, and sometimes they undergo calcifications to form cementicles. The next and the last cell types are defense cells. In periodontal ligament, we have 3 types of defense cells, that is mast cells, eosinophils, and macrophages. The macrophages and eosinophils usually capable of phagocytosis of dead cells, whereas the mast cells helps in secretion of histamine, which causes proliferation of endothelial and mesenchymal cells. Next, we have the extracellular substance, that is fibers and ground substance. For fibers, we have collagen fiber, elastic, reticular, secondary fibers, and indifferent fibers plexus. And for ground substances, we have proteoglycans and glycoproteins. Now, for fibers, the main fibers of periodontal ligament is collagen fiber. The main type of collagen fiber is type 1 and type 3. The type 1 is most common, that is almost of 70%, and type 3 is of 20%. The other collagen fiber is 5, 6, 12, also present in periodontal ligament. Usually the collagen is gathered to form bundles approximately in 5 micrometer, which can be shown in the diagram. And this bundle is known as principal fibers. Now, as we move to the principal fibers, there are 6 types of principal fibers found in periodontal ligament. The first is transeptal, then alveolar face group, horizontal group, interradicular group, oblique group, and apical group. The transeptal group usually extends interproximally over the alveolar crest bone and embedded in the cementum. The next we have alveolar crest bone, which extends from the cementum beneath the junctional epithelium above the alveolar crest bone, which prevents extrusion, intrusion, displacement. The third group is horizontal group, which extends horizontally from the cementum to the alveolar bone, and they resist horizontal and tipping forces. The next group is oblique group, which extends from the cementum to the alveolar bone obliquely in the coronal direction, and they resist vertical masticatory forces and prevents intrusion. Next, we have apical group, which extends from the cementum to the apical region of the tooth sockets, and they also resist vertical, luxative, and twisting forces. The last group we have is interradicular group, which extends from the cementum to the bifurcation area of the multi-rooted tooth, which also resists tipping, torquing, and luxation. Next fibers, that is an important one, that is Sharp's fiber. Now, as we see in the diagram, the ends of the periodontal ligament that are embedded in the cementum and also in the alveolar bone surface is known as Sharp's fiber. On the cementum side, the fibers are much thinner and are...
Nafisa, your 8 minutes is over.
And the alveolar side, they are much thicker. Next, we have elastic fibers. The elastic fibers of 2 types, that the mature ones and the immature ones. The immature ones are eulalin fibers and oxytalin fibers, and these fibers help in supporting blood vessels in periodontal ligament. Next, we have reticular fibers and secondary fibers. The reticular fibers are usually immature collagen fibers with argyrophilic staining, and the secondary fibers are newly formed collagenous substances which are located between and among the principal fibers. The last fibers that we have is indifferent fibers plexus, which usually described by Shackelford in 1971. This plexus is formed by small collagen fibers along with principal collagen fibers that run in all directions, forming the plexus. Once the tooth comes in clinical occlusion, the fibers are no longer demonstrable. Now, the last topic of my presentation is ground substances, which is like a gel-like matrix synthesized by the fibroblast family and fills the space between the fibers and scales. They are usually biochemically complex, highly hydrated, and semi-solid gel. Usually, they are composed of water, glycosaminoglycans, and glycoproteins. Water content is of 70%, whereas the glycosaminoglycans are of 2 types, hyaluronic acid and proteoglycans. And for glycoproteins, we have fibronectin, laminin, fibronectin, and tenasins. References from, I have taken all the informations. Now, I would like to request Dr. Tahira Mizan to continue the rest of the presentation. Thank you.
Thank you so much, Nafisa Apu. Now I would like to call Dr. Tahira Mizan Apu for her presentation.
Thank you, Ifrat Jahan Raha. Hello, everyone. I am Tahira Mizan, Intern Doctor at Ibrahim Medical College, Dental Unit, Session 2015. Greetings to my respected professors, Professor Dr. Farida ma'am, Professor Dr. Anirban Chatterjee sir, Professor Dr. Anupam Podder sir, and thanks to the Axis Dental School for arranging such an informative program. So let's start to my presentation. My topic is periodontal ligament. If Nafisa Firdaus, please stop your screen, please. I cannot share my.
Yes.
Thank you. Thank you. Thank you. So my topic is periodontal ligament. The content of my topic is blood supply, nerve supply, lymphatic drainage of periodontal ligament, functions, age changes, regulation of periodontal ligament with periodontal ligament relationship with dental implant, and lastly, conclusion and some references. Which foundation do you want? Actually, we want a well foundation.
Sorry
like
to interrupt you, but screen share টা maybe কাজ করছে না।
জি স্ক্রিন শেয়ারটা হচ্ছে না।
আপনার স্ক্রিন শেয়ারটা দেখা যাচ্ছে না।
সরি কি দেখা যাচ্ছে?
জি আপনি
ওকে
সরি স্যার।
ওকে
Which foundation do you want? Actually, we want a well foundation. For example, our foundation of our tooth actually depends on its element, like periodontium. And health of the periodontium, it depends on its element, like its supply, nutritional supply, nerve supply, and lymphatic drainage. We all know that periodontal ligament is a soft connective tissue. So the structure present in connective tissues are vessels, lymphatics, nerves, and cementicles. Here we put a picture of histological slide that containing this is artery, this is vein, and this is nerve. So let's talk about the blood supply of periodontal ligament. This is highly vascular and supplies from superior and inferior dental artery. The branches from this is dental artery from the apical vessels, and this is interradicular artery which supply the interradicular spaces, and this is gingival vessels which is supplied by superior periosteal artery. Let's discuss about the lymphatic drainage of periodontal ligament. Lymph node that draining from the periodontal ligament is usually follow the pathway of the blood vessels in the apical region. Then it enters into the inferior dental canal in mandible and infraorbital canal in maxilla, and then finally run the submandibular nodes, and this is submandibular nodes. My next topic is nerve supply of periodontal ligament. Nerve usually passes through the apical foramen. Here it is apical foramen, and the nerves are the branches of second and third division of trigeminal nerve, the nerve that carry the sensation of touch, pain, pressure, and proprioception during mastication. These all sensations are carried by 4 types of ending, nerve ending. These are free nerve ending, Raffinis type of ending, spindle type of ending, and Mizan's corpuscle. Free nerve ending, this is sensory in nature, located in the cementum and carry pain sensation. Raffinis type of ending, which is mechanoreceptor and carry pressure sensation. Spindle type of ending, which is located in the apex, and Mizan's corpuscle, which is located in the mid-root region, and they both are carry pressure sensation. Lastly, cementicles. They are calcified bodies and the mass of cementum, which present in periodontal ligament. They are either free in connective tissue or fused as a large calcified mass. Usually they are found in old age or at the site of the trauma. This is free cementicles, and this is fused cementicles, which is fused to the cementum. And the most important thing, functions of the periodontal ligament. There are 4 types of function. First one is physical or supportive, another is nutritive, third one is sensory, and last one is formative. So supportive function. Supportive function is the periodontal ligament support the tooth, and tooth attached to the bone as well as cementum, and they also act as a shock absorber, cushioning like action. They transmit the occlusal force to the alveolar bone and also protect the blood vessels and nerve supply. Nutritive function. They provide nutrition to the cementum, alveolar bone, and gingiva through their blood vessels and lymphatics. Then sensory supply. They usually carry sensation of pain, touch, pressure through the trigeminal pathway. And last one is formative function. Formative function is they help in formation and resorption of cementum. The next topic is 8 changes of periodontal ligament. Here I put a slide or put a picture that's showing in second picture, this is showing that periodontal ligament cells are more, but in the first slide, due to increasing the age, decreasing the width of the periodontal ligament as well as decreasing the cells of the periodontal ligament, and otherwise also decreasing the masticatory muscle strength, decreasing the vascularity, mitotic activity, and as well as increasing elastic fiber. Then regulation of periodontal ligament width. It is an important measure of periodontal ligament homeostasis. Here I put a picture which showing that fibroblast, that is the cell, main cell of periodontal ligament, this fibroblast secreting some regulatory proteins like calcitonin, cytokine, interleukins, which inhibit mineralization and also inhibit bone resorption. That's why the cells of the periodontal ligament maintaining the width of the periodontal ligament. Next slide is relationship of periodontal ligament with implant. We all know that implant has no periodontal ligament. That's why they do not employ a gum process. And also there is no mechanoreceptor in implant. That's why reduced tactile sensation and reflex function. And as well as in case of premature contact, no intrusion or migration can be achieved. Lastly, I put conclusion, that is periodontal ligament is a fibrous connective tissue forming an important part of periodontium and its important elements and unique function that maintaining tooth function and equilibrium. And yet the integrity of the periodontal ligament and alveolar bone is one of the most important challenging, and we also keep the periodontium healthy. Lastly, I put some references where I collect this. This is Karanja from 4th edition and Ted Care's Oral Histology 5th edition. Thank you everyone for listening my presentation, and thanks to Axial Dental School for arranging such informative program, and special thanks to Anupam Podder sir, who always put their helping hand on us. Stay safe and keep smiling. Thank you.
Thank you so much, Tahira Binti Mizan Apu. So our presenter has already presented their beautiful presentation. Now it's time to start our discussion part. So I would request our three honorable judges to start the discussion part. First of all, the discussion will be on the presentation of Dr. Mohammad Emon Talukder. So first of all, I would like to ask Anirban sir to discuss the part of the Dr. Emon Talukder.
Okay, Mohammad Talukder, I just want to ask you one thing. What is the dentogingival unit? Dentogingival unit. Are you able to hear me? Yeah.
Dr. Emon Bhaiya, your mic is muted. Can you unmute your mic, please?
Sorry.
What is dentogingival unit?
Sir, this is the complex point from to which the periodontal ligament attached with the lamina propria of the gingiva.
No, it is not correct. Dentogingival unit is related to junctional epithelium and gingival fibers, not periodontal fibers. Periodontal fibers are strong attachment now. Gingival fibers with junctional epithelium, which is one of the most important aspects of our unit, is known as dentogingival unit. Okay. What is the elasticity of the periodontal ligament or tensile strength of the periodontal ligament? Tensile strength koto?
Sir, measurement sir, sorry sir.
Measurement na. Tensile strength. কতটা স্ট্রেচ করতে পারে টেনসাইল স্ট্রেংথ?
স্যার আমি কোশ্চেনটা বুঝিনি স্যার, যদি আছে আরেকবার একটু।
টেনসাইল ওটা একটা পেরিডন্টাল লিগামেন্টে টেনসাইল স্ট্রেংথ থাকে, মানে স্ট্রেস টেনসাইল স্ট্রেংথ কতটা টানতে পারে, ওটা কতটা এক্সটেন্ড করার পরে ওটা ছিঁড়ে যাবে। বুঝেছো এখন?
Sir, sorry, sir, এটা জানা নেই, sir.
আচ্ছা, what is intermediary plexus? Intermediary plexus. Intermediary plexus. যে কোনো একজন আনসার করতে পারে। ইটস নট দ্যাট পার্টিকুলারলি ইমামের বলে না, যে কোনো তিনজনের মধ্যে যদি জানে যে কেউ আনসার করতে পারে। Intermediary plexus.
Sir, can I answer, sir?
Yes, please.
Sir, this is a type of fibers which are usually this plexus is usually formed by small collagen fibers in associated with principal collagen fibers which run in all directions, forming the intermediate fiber plexus.
Good.
Small collagen fibers along with principal collagen fibers.
Yes, good.
Yes.
Next question will be, what type of anyone out of any three or anyone, which type of collagen is present in periodontal ligament fibers?
Sir, type 1 and type 2.
Type 3.
Type 1 and type 3. Yes.
Type 1 and type 3. What about type 5?
5, 6, 12 also, sir.
Yes.
Exactly.
Yes, sir.
Can you, yeah, tell me. Anyone?
Yes.
I'm requesting all of the presenter to on your video, please.
Sorry, sir. Done.
Good. Can you tell me any one of you? I'm asking all three, any one of you. Which is the longest periodontal ligament?
Longest periodontal ligament, sir.
Yes.
Sir, oblique fibers.
Okay. If there is tear in the periodontal ligament, any of the periodontal ligament is lost, which is the first periodontal ligament to get attached to the cement one?
Sorry, sir. Again.
If the periodontal ligament is detached, or it is due to infection, something, okay, there is which is the periodontal ligament which gets attached first out of the 6?
Which one detached first, sir?
Not detached, attached.
Attached first.
Yes.
Okay.
These are the oblique.
Sir, transeptal fibers.
Okay, good. There's the first one to get attached.
So transeptal fibers.
Yes. Correct. Thank you.
Okay.
I think that's enough. Can anybody tell me what is in the theories of periodontal ligament? The
what?
gel theory. Anyone of them?
Yes, sir.
There are theories of periodontal. How does the periodontal ligament work in hourglass formation? Correct. Structure is hourglass formation. How does it work in a gel? What is the theory of gel?
Due to the presence of ground substances.
So how it works? Thixotropic gel. It works on a theory of a thixotropic gel. What is that theory?
What is that?
Do you know the theories of periodontal ligament? How does it work? Periodontal ligament. There is one theory known as thixotropic gel theory.
I do not have.
Periodontal ligament structure theory.
Thixotropic gel theory. Thixotropic gel theory. No, it's okay. You have presented very well. All three have answered very well. Who was the other one? I couldn't see her video. I don't know. So whoever has answered, it's good. All three of you presented excellent presentation. Excellent work.
So for your information, the answer was answered by Nafisa Afroze, Dr. Nafisa Afroze.
Okay. Fine. No. Everybody's answered. That's good. Everybody's presentation was excellent. I'm really impressed. Very good presentation. Thank you. Dr. Anupam, you can continue with that.
Okay. Now I would like to ask Dr. Anupam Podder, sir.
Thank you. I would like to thank all three presenters. This is the wonderful presentation of these three presenters. Dr. Tahira, Dr. Nafisa, and Dr. Emon. Excellent presentation. I'm very happy to your presentation. And in case of Dr. Emon, I had a query. If you use the laptop, it is better, but I cannot see your eye contact and body language. But I cannot see you in the my laptop. So if you use in laptop, it is better to I can see your eye contact and body language. Otherwise, your all in the logical sequence and pronunciation, formation, all are okay. But further, when you are in any presentation, you must use the laptop for excellent presentation.
I remember it.
Yeah. And Nafisa Afroze is good, better, and he is doing better. I hope he will much more better in next episode, next program, any type of program. And he's all type of, I think, his voice modulation, his body language, eye contact, pronunciation, and slide formation, all are okay, I think. And just like the Tahira Afroze also, the picture table configuration is excellent, and pronunciation, voice modulation, and time sense. Time sense is all are equal, and no take much more time. So and the addition, the audience attraction of these three speakers is very much enjoyable, and I think I enjoyed this presentation. I hope every viewer and upcoming viewer enjoyed this presentation, and it will be helpful to our students who are teeth exam in third provisional examination, third phase that will be held in the November or December. I think every my student who are in third phase must must see this presentation, and it will be helpful to your exam. Thank you.
Thank you, sir. Due to some official work, Farida ma'am has to leave the meeting. So I would like to request Anirban sir to discuss the other two participants' presentation, Dr. Tahira and Dr. Nafisa, sir.
All the three presenters were really good. There's no doubt about it. So, Amar Mane, extent there is nothing to talk regarding. Everything was perfect. So I would like to tell that Tahira hope, Imam hope, or Arekjon, the presenter, definitely presentation খুবই ভালো ছিল, excellent presentation. Might be there are something every presentation there is scope of improvement, but এখানে I would give মানে প্রেজেন্টেশনের পক্ষে কথা বলা, the discussion তারপরে the learning process was almost 95% out of 100 was what is my way of thinking. Everybody has excellently, yes, they have done. একটু some people একজনের একটু কম থাকে, একটু বেশি থাকে কাউর, আর কাউর knowledge একটু বেশি একটু কম, but all three were excellent. So there is nothing আমার কোনো মানে there is nothing I can tell. It's wonderfully presented. Only thing is this is how the way you can take it forward. And এটা যে প্রেজেন্ট করেছো, এটা পুরো periodontal ligamentটা it should be তোমাদের এখন মাথায় থাকা উচিত, যাতে কোনো কোশ্চেন এলে you will be able to answer so well. Any question related to periodontal ligament, you should master it. 10 মার্কের কোশ্চেন তোমরা 9 পাওয়া উচিত। আমি শুধু তিনজনের বলছি না, আরো যারা পার্টিসিপেন্ট আছে সবাই ছিল, everybody, so they should get it. That's all, nothing else.
Thank you, sir.
Very good, very good.
Thank you, sir.
We are extremely sorry that Farida ma'am couldn't join again due to some official work. She had to leave. So our program is, I think, all presenter and the discussion part is over. So if Anupam sir and Anirban sir allowed, should we end the program, sir?
Of course, of course.
Definitely. You can end the program. Very, very fruitful program.
Thank you, sir.
And all